and stop propagating mindless stigma about both fields.
I get legitimately angry whenever I get asked this question. Is my GPA high enough to apply MD, or should I just apply DO? I'm not even going to be particularly constructive about this one. Who do you think you are? The amount of entitlement and ignorance that comes across in that question is just violently offensive. MDs and DOs in the American healthcare system work side by side, seeing all of the same patients. Some of my most skilled colleagues are osteopaths. Some of them are MDs. But then there's another side of a coin which I find equally ridiculous, which is where people say, I wanted to be an MD, but I really think I want to be more holistic. Do you think that holistic thinking is gated behind a degree? Now you've gone and offended all the MDs, because I'm out here with my MD thinking, well, I try to think pretty holistically. I'm no wellness influencer or anything getting at the root causes of disease, but I do try to be pretty thoughtful in my diagnostic reasoning. If you actually want to become a doctor, you need to get this Reddit level stigma out of your mind, because it comes off as really ignorant and entitled. How you choose to practice your degree of clinical skill, diagnostic rationale, is contingent upon your philosophies and how you train and how you treat people. You're not just going to get a degree that's going to make you holistic. I've also seen people in every specialty, every surgical specialty, medical specialty, psychiatry, whatever you want, who are MDs and who are DOs. Yeah, the process is different, but these blanket assumptions that MDs can't be holistic or that DO is the thing you do if your GPA isn't good enough are absolutely ridiculous. And I'm saying this as someone who trained at an MD school and went away to do an elective at a DO school to learn some of the art of osteopathic manipulative medicine. Figure out what training approach resonates with you and go for that. Substantiate your interest and respect the art, respect the field, respect the craft. At the end of the day, you're applying to do some of the most sensitive and impactful work that I can imagine. You would be lucky to become either an MD or a DO. It would be an honor. Shift that mindset.